my contribution to Rural Healthy People 2030 was in section chapter 5, Rural Substance Misuse and Trends in America. I co-wrote that with Miss Gracie Woodland and then the current department head here in health behavior, Dr. Adam Berry. I have a unique passion in this where I grew up in a rural community of 1,200 people, graduated with 25 people, and I was exposed to alcohol use and substance use really early on. And to me, that was a normalized behavior until I realized that it wasn't. And what happened was just as I grew older, I started to see the ramifications of alcohol use on family members, and I didn't, and loved ones, and even friends, and I didn't know what that looked like until currently, as I'm doing research, I'm like, this really is a problem. So that's kind of where, why this was a topic that I chose, and you know, what was grateful that I was asked to contribute to. The disparities between rural and urban in terms of substance use, they're maybe not as far as people think they are, but what happens is it's the way that it's happening within these communities, especially within racial and ethnic minorities. Substance use disorder, alcohol use disorder is still high among American Indian, Alaskan Native individuals. It's access in rural America to treatment, whether that be mental health, and in this case, substance use issues, that make this a prevalent thing to address. I'd like to see access to it. And I know that doesn't solve the problem. I know it's hard for a company to just build a brick and mortar somewhere and be like, come here for your treatment. So we have to adjust to what those limitations are. And for me, that'd be something along the lines of maybe mHealth, mobile health, ecological monitoring assessments where we can actually in real time get you to answer questions through your text message, through phone, and then of course text message based interventions. Just to kind of throw out a few numbers, 90% of Americans own a phone to some capacity. Maybe they're not all smartphones, but I assume a majority of them are, both rural and urban communities. And around 7 to 10 Americans are on social networking sites, at least adults are. So I think we could leverage both of those things, but we have to find a way to get to individuals in rural communities going forward with this mobile health text message intervention programs. Would bring it to them, which is maybe something that hasn't been done in a vast way.